Okay, got it.
Great. Thank you all for joining us today. We're just about on for the Memorial Day weekend, so we appreciate all your energy and enthusiasm in the last half of the day of day 4 of Internet Week. And this is the panel I am most excited about, revolution of technology in healthcare. And what we're going to cover today is how does technology have the potential to transform the way patients engage with doctors and hospitals, and how can it empower patients to take control of their own health? So to join me in this incredible discussion, this groundbreaking talk, I have Mario Schlosser, the co-founder of Oscar, Brad Weinberg, the co-founder of Blueprint Health Accelerator, and Aurelia Boyer, the CIO of New York Presbyterian Hospital. And I want you all to tell us a little bit more about yourselves and your business, and then I'll get into the questions.
Sure, yeah. It's great to be here, first of all. Great to have you guys here. So Mario, the co-founder and co-CEO of Oscar. Oscar is a health insurance company. We started about 2.5 years ago. So one of our co-founders, Josh Kushner, opened his insurance bill and had no idea what it meant. He realized he spends part of his life investing in companies like Instagram, Spotify, and so on. Was sort of surrounded with smart technology, great design, and so on. But then in this one important relationship he had between him and the health insurance company he had at the time, and more broadly the healthcare system really, he realized none of that was present really. It was sort of like clunky old technology, difficult to understand which doctors in the network and things like that. And 2.5 years forward, we're now a fully fledged health insurance company. We offer insurance policies in the Obamacare-enabled exchanges. In particular, the one in New York, in kind of like the 9 downstate counties, New York City, Long Island, Westchester, Rockland County. And it's been an amazing journey. We try to make things simple for people. We try to kind of guide them through the healthcare system, and in the best case, make you feel like you have a doctor in the family.
Good to have.
Thank you.
Hey there. I'm Brad Weinberg. I run one of the founders of Blueprint Health. We're an early stage investment firm and accelerator, solely in healthcare IT companies here in New York. Kind of really started out of my experience starting a company when I was in medical school and growing that company and seeing both the amazing experiences and the challenges of starting a company in the healthcare space. And we take kind of a lot of that knowledge and the knowledge of a community of over 200 mentors to help people really make those connections into the healthcare space and figure out how to navigate what is a pretty difficult industry to start a technology-enabled company in sometimes, and make that a lot easier.
Great, thank you.
So hi, I'm Aurelia Boyer. I'm the CIO at New York Presbyterian Hospital. You know it is Columbia Presbyterian up at 168th Street, and you know it is the Cornell Hospital at 68th Street. I started my career as a registered nurse and have spent the last 10 years bringing the base transaction systems into the clinical part of a hospital. So until very recently, most of that was done on paper and was very cumbersome. And now that we actually have a lot of automation, we're really starting to look to others, people like Blueprint, to bring exciting new technology in that really starts changing how we can do things. And certainly one of our biggest emphasis in the last few years has been patient engagement. And so we were really one of the first hospitals that said you can log on, you can get your medical record, and you not only can look at your medical record, you can take it and move it to something like HealthVault or other places so that you control where your records go in the future instead of going, I can't get my paper records, and dragging things around with you. So we've just started that journey, and we'd like to do a lot more.
Thank you, and that's such an important thing. I know oftentimes many of us, when we even ask the doctors for our records, we kind of feel like, is that appropriate, is that inappropriate? And we should be able to bring those around.
Yeah, but I do think over the years, the healthcare system has taught you it's not appropriate to ask for your records.
Absolutely.
We have considered them to be our private business where we write things down. And so this is a big cultural change for us too, to say, yes, And I'm very proud of my institution, have said over 5 years ago, yes, that's your data, that's your information, and we're going to give it to you.
That's great. Thank you. And speaking to the changes, New York Presbyterian recently hosted its first tech hackathon. It's a big deal. It's the first one for a major New York hospital, and that was back in March. The topic was improving the online patient experience through the application I want to say it's nyp.org. All three of you were judges, so we have the band back together again. Aurelia, if you want to tell us, why did a large institution like a hospital want to host a hackathon? How was it, and were there any applications you can imagine being implemented at NYP?
So, you know, it's really interesting. You all talk about we want to drive healthcare costs down. So at the same time, we as an institution want to spend more and more money on technology. And I believe there's a balance where instead of us developing everything ourselves or relying on a very few vendors, which is what healthcare has done so far, there's only like 5 major vendors we all buy our systems from. So I don't think that's the right price control that you would like in an industry. So if we can start innovating and getting small companies to do things, and if I can work with people like Blueprint and you guys, give you the place to try it out, I save money, you get the chance to develop something that maybe becomes a profitable company. So we think that's a really interesting mix that we haven't done in healthcare. And so we wanted to start down that road, and having the hackathon was our first step into doing that.
Great, thanks. And Mario and Brad, what was the response like from the startup community? You know, did they think it was refreshing to see a hospital put themselves out there to ask, you know, how can we improve? Or were they like, I don't get it, I don't relate to this big hospital, I just want to, you know, do something on my app? So what was the response?
Yeah, so the response was really positive. I think the biggest change that we're seeing in healthcare today is that these large organizations, NYP being one of the ones that's on the leading edge, but also certain health insurance companies, certain provider groups, are starting to work with other people. They're starting to kind of open up the kimono a little bit. And I think what the tech community and the entrepreneurial community needs to know about the healthcare industry is you have to build those relationships to be successful in this industry. It's very unlikely that, you know, 2 guys in a dorm room are going to build an app that services the healthcare industry effectively because of how payment models work, because of kind of how businesses are built. So you really have to establish these relationships, and because of a whole host of factors, some of it being governmental related, some of it being press related, people are starting to open up the doors. And I think we have to commend those institutions that are doing that and the people that are driving that. And I think the tech community answered pretty well. I think you had, you know, over 100 people there, or something of that number, that built some pretty amazing apps.
Yeah, we had 17 teams, and we had 3 winners, and all of them were strong. They actually built code that we're in discussions about putting in place now, so that when patients are inside our hospital, they can use a tablet and use social media kinds of things to connect, to learn, and to totally bring your, you know, you're all walking around with your tablets. Well, let's bring that into the hospital, and not our old-fashioned push a button and a nurse comes.
Yeah. So I want to echo what both of you guys said. I think if you want to have an impact in the world of healthcare, you need to sort of do it from the inside out rather than from the outside in. A lot of what is happening in Silicon Valley in terms of health applications and so on is sometimes a bit too much coming from the outside in. And the hackathon really underscored why connecting to systems that exists, being with insurance companies that exist already, kind of tapping into those connections is really important. The company I think we gave the first prize to, what they ended up doing was they used some of the claims data and the healthcare data in the systems at Presbyterian to connect people over video chats who have similar diseases in the hospital for similar reasons. And it's sort of like a very easy way of creating these sort of ad hoc patient groups of similar patients and have them talk with each other and so on. Now, that's not necessarily difficult technology to build. You fire up Google Hangout or whatever, you kind of have the video chat component going. But what is difficult is to ask people, what exactly is wrong with you, who is similar to you, who could help
Yes.
you understand your condition and so on. And if you have the health data directly from the systems of the doctors and nurses who treat you, then suddenly this becomes a very, very powerful combination. So that's a great example for coming from the inside out and building something with existing components. And I think that's the way sort of like healthcare IT has to develop, and it's the reason why we got excited originally to become an insurance company, because the insurance company, you are kind of at the center of the system, in sort of like in the way the data flows and in the way the payments flow.
Now, how do you work within all the forms and paperwork bureaucracy and the privacy rules?
Yeah.
You know, it just
I think one, you respect them. You know, they're there for a reason. You don't want to sort of like come in there blazing and say everything that was here before is stupid. You know, there's a reason why there's smart privacy rules and so on.
Yeah.
So you build around things like HIPAA.
Yeah.
You're smart about how to implement, you know, HIPAA compliance services and things like that. But the second thing is you sort of like step by step push the boundaries a little bit. And one example I can give as well is in our plans we have a televisit benefit, meaning you can push a button in the phone, in your phone application, or in the Oscar application on the phone, and a doctor will call you back in about 20, 30 minutes or so and can e-diagnose you, give you prescription, stuff like that. That doctor punches a couple of notes into his computer. And those notes are basically what he tells you over the phone, right? So follow up, what do you do next? You had a cold, I told you to get a prescription, you should do this and, you know, stay warm for 7 days or whatever, right? We started putting those notes into our website, basically. So if you log in as an Oscar member into the website, you kind of see the notes there from the calls coming in real time. And that was surprisingly a sort of like big convincing act at first.
Yeah.
Even though the docs tell you this over the phone, what you should do, even though they write it down for themselves, the mere fact of taking what they wrote down, showing it to you again online, takes some convincing to do and some getting used to for the doctors, because they're not so used to more transparency, education exactly around this. And so that's, I think, where you sort of like want to push the boundaries step by step and go out a little more and give consumers a bit more information that they can deal with in a good way.
Great.
You know, the privacy issue is a difficult one for a big institution like ours. And I do think it mirrors the larger conversation about privacy. It is specific to healthcare, but we want to share information more. We want to make it travel with you. So if you get sick and you're in London, you shouldn't be cut off from your record. So I want them to travel with you. But now I have to protect it in a privacy way. And so when you argue with yourself, should Google be going through data and learning about you or not? Well, should the healthcare system be going through your data in a wide way and learning or not? And I think most consumers are of mixed minds. You're used to us keeping it a secret. And so I think we need all of you to be involved in that conversation, because right now it's a conversation between healthcare providers and the government, and I think consumers should get more involved in this discussion going forward.
How would you suggest they do that?
Oh, now that's really a good question. But so I think when we have opportunities to get your data, to ask for your data, the government now requires us to release your data to you electronically. They just passed the law and it's new. If you aren't doing that, and not that many of our patients log on, I mean, we almost have to beg people to do it. If you're not doing it and you're not learning what it does for you, and you're not part of the conversation, because there is a big conversation. They hold hearings on it all the time. And if the media is not having the right conversation about it, I think you're shortchanging your own future and controlling your healthcare information.
And a lot of what we talk about with our entrepreneurs is not being scared of these things. There is a learning curve. You have to get up to scale on what these terms mean, and you can't go meet with someone like Aurelia and not know how to talk about these things. That will shut you down at the door. But it also isn't that complex. You have to find the right organizations, the right people that have been there and done it before. I think that's what's a little different about this industry than others. Like, you need to do that kind of groundwork at the beginning. But like like was said before, it shouldn't make you afraid. And you can make a couple of mistakes like you do in anything. Like, you're gonna have to fail a couple times, learn from those failures, build those right relationships, and then you can be very successful in this industry.
Great. What do you think the patient experience will look like in 5 years?
I think there will be a lot more transparency into how the healthcare system works generally. So you'll have a better idea of what things will cost.
Yep.
That's happening already. What needs to be connected to that is a better idea of how high of a quality certain providers bring with them, right? We're talking a lot about cost transparency. We're not yet talking so much about quality transparency.
Yeah.
What's a good hospital, what's not a great hospital, which department's good for what, and so on. That I think so more transparency around that will be there. There'll probably be more responsibility on the part of the patient as well. Deductibles are rising on the insurance side of things. If you look at the Obamacare-enabled exchanges, kind of like the average plan probably has a $1,000, $2,000 deductible, which means the patient will have to pay more of his healthcare costs early on. That will probably happen on the employer-employee side as well. And that means patients overall have to become more educated as to how they utilize healthcare services before they even utilize them. And the providers also have to go along with them on that education journey and take patients along that as well.
What do you mean by they have to be more educated? Can you give me an example of how these folks with a $1,000 deductible will use their own $1,000 wisely?
Healthcare is a weird market in that when we look at the data coming through our claim system, for example, we try to slot, as an example, doctors and providers into axes of how cost efficient are they and how effective, meaning how high or low quality are they. And healthcare is probably one of the few markets where if you plot doctors into a chart of like cost versus quality, there's almost no correlation. There's nothing in that market that forces you, if you're a high cost provider, to be also high quality, or if you're a low cost provider, to maybe lower your prices so you can take care of some simple conditions but not the more complex conditions. And I think that's the more financial responsibility patients will have, the more transparency overall will come into the market, the more that kind of like market will develop towards, if you want to have, so that access basically developing in a smarter way.
But by responsibility, does it mean saying to a doctor, I don't need this test? Or what do you mean by responsibility?
It may simply sometimes mean, I think I should get this test done at LabCorp or Quest, because those labs are very, very good at it. Exactly, instead of sending it to some office across the street or something like that. Because sort of like there are incredibly specialized providers in the healthcare system that do some things incredibly well, and that should do certain things incredibly well. And sort of knowing more about how all that works together can be part of the patient's responsibility.
And now with all the transparency of information, as I think we discussed, and who knows where services like Yelp will be.
Yeah.
And kind of can talk to you. LabQuest is better than this one.
Exactly, and just finding good quality metrics as well, right? There's patient reviews are an interesting sort of like angle on quality. They're certainly not the full picture, right? They sort of like map out how nice of a guy the doctor is in many situations, or how well run an office sometimes is, which is sort of like a thing you do want to pay attention to, bedside manners and so on. They don't, from what we can tell at least, capture literally clinical quality that the situation.
It's just one tool.
Yeah.
So Brad, where do you think the patient will be the patient experience vis-a-vis tech will be in 5 years?
And 5 years in the healthcare space is actually a really short amount of time.
20 years.
Yeah. So I'll start. The two biggest kind of economic changes that are happening that are affecting the healthcare industry are one, what was mentioned about the movement to higher deductible health plans. So as people are moving to exchanges, both private exchanges and public exchanges, we're going to see people going from 20% high deductible plans to 80+% high deductible plans. That's going to drive a lot of the price transparency. The interaction between the patient and the doctor around price and the service they get out of it is going to be completely different. So we invested in a company called Symbiosis Health that allows you not only to book an appointment online like ZocDoc, but actually pay for it up front, out of pocket, and get a lower price. That's going to be a lot more relevant when you actually have to pay for these things out of pocket. And then for the people over 65, essentially people that are on Medicare or on Medicare, you're seeing the government trying to pay people off of kind of quality metrics. And I think the biggest change you're going to see there is some institutions looking at how they take care of people in a more comprehensive way. So you're going to see hospitals that actually don't only look at patients as, at them in the hospital, but they're actually going to say, how do we take care of this patient when they go home more comprehensively? So I think those are the two kind of the biggest things that I see are going to change. It's going to happen slowly. The economic pressures have to be there, but they're coming, and there's a lot of people moving on those.
So it almost seems like a return to, say, the 50s or the 40s, where you had a doctor that would do house calls, who would know your family, and the people would pay for it themselves. So it's kind of ironic that...
And hopefully a lot more technologically enabled, so it
Involved,
actually,
the feeling,
it doesn't have to be the doctor making the house call.
But it's a feeling of care that's,
Exactly.
And I think the increased transparency on the provider side into your health data as the consumer is an important aspect of this as well. Right now, if you're a doctor, you tend to not see a particular patient's health history, except for the narrow sliver as he went into your office. Exactly. You want to see, if you want to manage that patient's health more holistically, if he went to the emergency room between 2 times when he saw you, you want to see whether he's adherent to the medication you're prescribing and things like that. As a doctor, you want to see those kind of things. You really want to take care of the patients. And so I think that's where we are doing lots of work, partly with provider systems, to pull data out of provider systems, sort of serve it up to back to providers in more comprehensive ways and more holistic health histories.
Great. And then Aurelia, I'd love you to answer the question. And then also when you do, I'm curious about the patient's experience in the hospital. So from the moment they walk in, whether it's elective surgery, emergency room, what does that look like?
So, one of the reasons we've started with things like the patient tablet is your experience in the hospital really hasn't changed very much, probably in quite some time. The buildings might be newer and fancier, but our processes have changed very little. I think people will be in a hospital a lot less in the future. And when you're in the hospital, you're going to be there for a very short period of time. And so that is going to force you to have to take more responsibility for your care. And so, and we got really specialized. So as technology advanced, it forced us into specialization because you had to know so much about everything. So we joke about, I have a left ear specialist. Like, we are that specialized now, so that they can do a really good job, and maybe at the expense of some of this coordination of care. And so what we don't know in the industry right now is who should be coordinating that care. Should it be your insurance company? Should it be your primary physician? And how do we do that so it is efficient? Because if we do go back to the old model, it won't be efficient. And so I think there's a huge role for technology there and a bigger role for all of you in that part of your life. So the doctor isn't telling you where to go. That's what you're talking about. You're going to look and say, where should I go? And what factors are important to me when I make those decisions? Because in the past, you let us make all those decisions for you. We tell you where to get your lab tests. We tell you where to get your x-rays. We tell you which specialists to see. And that is not what you're doing with everything else. So I don't know, can we crowdsource healthcare? Maybe we should be. But your experience is going to change. But it is not going to be as fast as some of us would like. We do move really slowly.
And for better or worse, the one thing that I think most patients will love the most about the improved hospital experience is they'll be able to order food from their tablet right by their bedside. Maybe even get it delivered via Seamless or something. I mean, that's sadly what I think patients are going to love the most.
Right?
It's part of it. It's part of the experience, I guess.
That's great.
That's great. And to switch gears a little bit in the time we have remaining, wearables, such an interesting topic. And I'm curious where you all think wearables and some of the advancing technology, 3D printing, how will that play into healthcare? And then also, we can talk kind of pie in the sky, but really, I mean, what does that look like in terms of safety, and privacy and what have you? So,
I think there's wearables and there's diagnostics, and people need to realize those are two really different things. Most of the wearables out there are basic activity trackers. I think that's mostly going to be in the phone. I think, for a lot of the devices out there, I wouldn't make very long bets on Fitbit or the other guys.
You heard it here first.
I think they're great companies. I think the phone is a very dangerous competitor to them. I think on the diagnostic space, things that actually physicians use to diagnose medical conditions or that can make someone aware of something, there's probably potentials there, but we're just getting started there. We're right in the beginning.
I would say, sort of from a global macro perspective, the US healthcare system is a very expensive system overall. But where is the expense? It's not with people who already run every day to make them run even more, right? So the value in wearables, I think, is not so much in giving a Fitbit to everyone and make sure that you sort of like walk every staircase you see and things like that. It is much more on the side of trying to help people with chronic conditions in better ways. And so that's how we look at them. We're thinking through, for example, giving asthmatic patients in our membership base, sensors to make sure that they, use the inhaler on a regular basis and other things like that.
A little big brothery then?
Yeah, well, it depends, right? If you help patients manage their own health better and they feel demonstrably better, I don't think they will mind that there's data flowing back between some computer systems, right? As long as, of course, you have all the requisites technology in place and it's secure, it's safe, and things like that. If patients probably won't mind having a more direct linkage to a smart healthcare person, a doctor or a nurse who can look at their data and inform them if they should maybe change behavior to feel better about themselves. So I think that is where the real opportunity overall is when it comes to wearables, the chronic conditions and the treatments of those with the help of more direct data collection.
Thank you. And then finally, Aurelia.
Well, so one of the things I worry about with wearables is, I think, what Brad spoke about earlier. If we don't connect better between the people who are developing that and how we do things in the hospital, the connections are missing right now. And so I want good asthma tools for our patients, but I want them done in a way that I can make sure somebody back at the ranch can help with that. And that's why these partnerships are so important, because the way we are inside has a lot of problems. And so if we're not talking to you when you develop those things, they're going to be isolated. And then I don't think the healthcare system is going to change the way it needs to.
Couldn't agree more with that. I mean, that's again this sort of like inside out view, right? If you collect the data, you don't connect it back to the people who deliver the care, the provider networks, and you're sort of like lost as well.
Great. And before we go to questions, we have time for, I think, one question. I just want to ask Aurelia, who is the best person for startups to contact at your hospital if they want to partner? Do you have a partnership person? I imagine you're tremendously busy, but is there someone that fields these requests?
Yes, the Chris Coffey here, who's from Tusk Strategies, is helping us make those connections.
Great. Okay, and he's in the back, so Chris Coffey.
Coffey.
Great. And then finally, I just also want to say, speaking of contacting you, Aurelia's group is hiring, and Oscar's group is hiring as well. So exciting news. And so do we have time for any questions here? Yes, the young lady in the front.
He's coming.
So I actually work with a few pharmaceutical companies that are trying to develop, apps with clinical trials, and they want to get doctors to start prescribing them. So can you guys let me know what you think is the major barrier that's keeping doctors from prescribing apps to patients? And then my second question is, what's keeping insurance companies from covering a lot of, wearable technologies and things of that nature that could be beneficial to patients down the line, especially, ones with comorbidities?
On the app side of things, mostly because it's not on formulary, so it's not a FDA Class 2 certified app. There's one company that's actually already done that, a company called WellDoc, and they've done that for diabetes. So if you go through that process and you actually get it on formulary, and then you get physicians to realize that they can prescribe it on formulary just like anything else, and you have insurance companies that actually will pay for it, like WellDoc's done, you can get that part of the system. But you have to follow that process to get things adopted by the medical community. It has to go through proper clinical trials and beyond what's called formulary.
So the whole clinical trial market, I think, is confusing to physicians as well as patients. So one of the things we did do with MyNYP is if you can look up all the trials that are relevant to you based on your healthcare information that's actually in your record there. And so you can then sort through those. Now, to be really honest, if you do that at our place, you will get the clinical trials that are at Columbia Presbyterian or Weill Cornell, because we're, of course, serving ourselves. But the doctors don't know what trials are available. They can't match the patient to the trial effectively now, and the patients are not well informed either. And so there's a lot of missing technology here and a lot of missing data. So if we're not moving data around to say, oh, doctors would love, and we've done some things to say, you can just run through our clinical data now, and here's the 30 patients that actually qualify for your trial. Please call them up. I'm working the other end that says, hey, patients, this is relevant to you. You please call me up. But there are huge gaps around that right now, but we're trying to work it from both sides.
Great. Yeah, and if you want to give a closing thought, yeah.
Oh, well, I was going to answer the insurance part of the question.
Yeah.
I mean, one is come to the right insurance company, come to us. We can be faster at piloting, I think, new ideas, new variables, and so on. The second thing is, show that stuff works, right? I think that's really important for insurers generally. The problem is they require 10-year actuarial insights, whatever. That's not what you want. Healthcare, and this may be a parting thoughts, healthcare is one of those markets where it's still full of low-hanging fruits. You don't need to become incredibly sophisticated with predictive analytics and data use or whatever to have an impact on certain outcomes. You can just do some very, very simple things.
Yes.
It will improve patient experience, outcomes, etc.
Are those your friends?
They're just skipping through
Here, March is
the...
out.
Mario,
It's Internet Week.
Advertising for Oscar, exactly. And so find super simple ways of running small pilots without the payers, without the hospitals, or with a couple docs you just talk to and say, use this thing for 6 months or for a month or whatever, and show some very, very simple impacts and results. And then I think you're going to have the ear of many people in the healthcare system.
Great.
Yeah, and some of it, some of that's how you spin it. So a true prescription is something about reimbursement. So if you're really talking about a prescription in the true sense, you need to go through the proper systems. If you're talking about physicians just recommending something or kind of writing a faux prescription that's download this, then you just need to convince minds, convince physicians. And they're trained, they have a certain way they're trained to look at the efficacy of something, but you can convince people to do things in a lot of different ways. Obviously, good data is a great place to start.
Great, thank you. And thank you all. This was tremendously informative. I hope you all enjoyed this panel as much as we did. Our panelists are kindly offered to stick around for a few minutes to answer any of your questions. And on behalf of Internet Week, I'm delighted that they're here. And I think healthcare is such an important part of technology. So we hope you'll join us again.
Thank you.
Thank you all.
Thanks, guys.